Eric Hammer here, registered physiotherapist. Today I wanted to talk to you a little bit about shoulder impingement. Now, essentially what shoulder impingement is, it's irritation of either a bursa or a tendon off one of your rotator cuff tendons. It's called your supraspinatus tendon, which is located just below the acromion bone off of your shoulder blade. So essentially how this occurs is either the bursa, like I said, which is called the subacromial bursa, or the rotator cuff tendon, it gets irritated as a result of rubbing that takes place when we go into different positions and angles of the shoulder. So for example, with impingement syndrome, a lot of times what you'll find is that as a patient, as they lift up their arm, there's a specific angle where all of a sudden, it becomes really, really painful. And the patient can go through that still painful, and then all of a sudden, the last few degrees typically will actually be pain-free. And this is called a painful arc. And essentially what's happening during this painful arc is either the bursa, or as I described earlier, the tendon off of that rotator cuff tendon, it gets pinched and irritated between the bones of the acromion and the head of your humerus. So again, typically what you'll find is patients will describe a very specific angle in which it's painful, and it might even feel a little bit restricted and stuck. And it's typically around that, what I find is typically around that 90-degree mark. And specific activities that patients might complain about would include things such as driving a steering wheel, kind of going into this arc, so to speak here. Again, overhead positions will typically be painful. Sometimes you'll find too, hand behind back movements, perhaps putting on a coat, might be restricted and painful as well. You see this a lot with overhead sports and activities. So for example, volleyball players or perhaps with baseball, again, throwing. And the other characteristics that you find a lot with impingement syndrome is it's seen a lot with individuals who have to sit a lot, so in front of the computer, who are in this sort of slumped over position. I'll talk a little bit about why that occurs, but essentially posture tends to be very important in this condition. So again, what you'll find with this condition, I'm just going to go to the side here, is that a lot of individuals who sit, who are in front of the computer, who are typing, what you'll find is that the head of the humerus, essentially it protrudes forward, and we end up being in this sort of slouched or forward head and rounded shoulder position. And then as a result of being in this position, when somebody raises up their arm, there's essentially less space between, like I said, the head of the humerus and the acromion. And that's one of the reasons why people find that bursa or that rotator cuff tendon, why it gets pinched, because of the lack of space that occurs as a result of being in this poor posture and then trying to raise up the arm. Now, what I've found is a great way to treat impingement syndrome is using what's referred to as the McKenzie method of treating the shoulder. Now, what I've found with the McKenzie method is the reason it can be so helpful is because there's two potential reasons, as we talked about, in terms of why the head of the humerus will be forward, again, due to poor posture, etc. Now, one possibility is that the anterior capsule of the shoulder, so basically the front portion of the shoulder, is really, really tight, and that's, again, forcing that the head of your humerus forward, which again is going to cause that irritation when we're around that 90-degree mark. Another possibility actually is that the posterior capsule of the shoulder is really, really tight, and in fact it would be, as a result of the tightness there, it actually pushes the head of the humerus forward as well. So there's kind of two distinct possibilities in terms of that shoulder being forward, either super tightness in the posterior capsule of the shoulder, or tightness pulling the shoulder forward in the anterior capsule. Now, the reason I like the McKenzie method in terms of treating this is that depending on if it's the anterior or the posterior capsule, the repeated movement can be helpful in treating either one. So essentially what the McKenzie method is in terms of treating either the shoulder, the back, hip, any extremity or the back, as we talked about, is repeated bias in a certain position. So for example, with disc issues in the lower back, the McKenzie method in a lot of cases would promote repeated extension movements in order to take pressure off the nerve root and ideally return the individual to full function without having any peripheral symptoms. Now, how you would treat it with regards to the shoulder in this case is you would try either an anterior or a posterior bias in the shoulder and see if the pain is either provoked or if it's just stiffness essentially that you're moving through. So a lot of times if there's actually provoking symptoms in terms of the exact pain you're getting, you want to stop that. However, if it's more that you're going into a limitation where it's just a restriction in the shoulder but no recurring pain, you'd want to actually continue biasing that specific position. So I'm going to show you those two positions that you can work on. So if we're thinking that it's more due to an anterior restriction, how you would start out in terms of treating this would be repeated extensions back first. So again, as you're going into this position, you want to make sure that you're not producing any pain or discomfort into that area that you were getting your pain with in terms of the impingement syndrome. So I find that in my own experience that the anterior restriction is typically the most common restriction with impingement syndrome. And so a lot of times people will actually lack that hand behind back movement. So as you're repeating this extension back position, again, we don't want to be provoking any pain or discomfort. You'll be going into a bit of a restriction. And then again, as you're repeating, you should find, oh, okay, well, I'm able to go a little bit further each time I move back. And again, the idea is it's not provoking any of your symptoms. From that position then, you actually want to start bringing that hand behind your back and repeat hand behind back movement. Again, we don't want to be going into any sort of pain or discomfort as you're doing this, but the idea is we want to be improving and increasing the mobility into that anterior position. And then what you should find is that after you've repeated that for several minutes, you can actually recheck to see if you're able to go into that impingement painful arc position easier. So then you would go back to, okay, well, where's my pain? And a lot of times what patients will find is that they're able now, that the angle changes and you're actually able to go a little bit further before that pain comes on. So perhaps before doing that repeated action, your pain was right around 90. Now, oh, well, I can go a little bit further before that pain comes on. And then, like I said, you would just keep repeating, okay, extensions back, extensions hand behind back, keep repeating, and then recheck, okay, well, where's my pain now? So that would be typically for, again, an anterior restriction.